last week we were talking about overwhelm, and
Right.
then 2 weeks ago we talked about feeling helpless. Doctors, nurses, all those healthcare professionals, so many are extremely compassionate and feel so close to the patients. Our team here, our doctors and nurses and everyone, we care so much about the patient, and there's this really not only caring, but we love them. And
Right.
they really feel the same way towards us, of course. When things don't go the way we think they should be, and patients are going through a lot of pain, if it's physical pain, emotional pain, we feel it. And then we have those feelings of helplessness. Other moments when several people are ill and we're so busy and we want to take care of everyone and be there for them, be them medically and emotionally and support them. But we just don't have that time because everyone is so busy. If many people are ill, I consider that being that sense of overwhelm that we were talking about. And then there is this issue that if this is not looked at, if we as doctors and nurses don't take care of ourselves and our staff, people get burned out.
Right.
And other healthcare professionals that don't know how to deal with these feelings, then they may go on to use alcohol or different things.
Right. We're at risk for that.
Big risk, and those statistics where there is a high risk of for healthcare professionals even committing suicide because they don't know how to cope with that emotion. They care so much about the patients, they don't know how to cope. So,
And there's a high divorce rate,
right,
high suicide rate, drug use. You know, it's, when you think about it, we're at risk.
right.
Right.
So we were talking about, you were mentioning a few things that were very helpful, of
Right.
things that we can do and to deal with this for doctors, nurses, and other healthcare professionals.
Well, it's really interesting because at the support group today, something came up with one of the patients. And another patient who she knew is not doing well, okay? And the patient was very upset because she's dealing with the same malignancy herself. And she's going to see her, and I kind of cautioned her, but this is not for doctors, it's just for a patient. And I said, there's a difference between sympathy and compassion.
Mm-hmm.
Sympathy is when I'm feeling what someone else is feeling.
Mm-hmm.
Compassion is knowing what that person is dealing with, but know it's theirs, it's not mine. It's just set of boundaries. And very often when we get so close to our patients now as doctors, those boundaries come down. You know, we become so connected to them that in a way we take on their emotional and energetic problems.
Right.
And now when something goes wrong, you know, or it doesn't even go wrong, it's the normal course of a cancer
Right.
process, we feel that we have failed.
Yes.
And in medical school, we're not told how to deal with helplessness or failure. But what's happened over the years, and especially since I've come out of medical school a long time ago, what's been so good in the medicine of the 21st century is we know the patient is intimately involved in their own care. So when we take all responsibility for ourselves, again, we're leading ourselves into potential burnout. Mm-hmm. So when I can't deal with my helplessness, when I just think I'm responsible for everything that happens, which is ridiculous. And the other piece that I found that helped me is if I could really find out what the patient believes and enter their belief system rather than having to hold on to mine. And when I have to do that, when I have to be in control as a doctor, over a period of time I get worn down. Rather than opening myself up to more possibilities than those I think I know. There might be something else out there. And again, I see this in the support group where I learn so much because someone has looked up something on the internet as a patient that I never knew, and now they're educating me. And the last thing I do, which really helps me personally, is every time I see a patient, and especially a new patient, I try to listen to them and listen to their life story. And if I could listen to their life story, they're also telling me about me. And that moves us, I have these many stages of a healer, but one of the last stages I see in our evolution is when a doctor realizes the person opposite them, the patient, is also there to heal them.
Right.
And that takes a huge amount of stress off me.
Right.
Because now I'm no longer separated from that individual as being a patient, but in their story I could identify that their wife is a little like my wife, or their kids are like my kids, or their childhood was a little like mine, and I see how it affects them, and I question myself, has that affected me? And we were taught in medical school not to deal with transference, but I think to be a good doc, there is transference, but it's not a sympathetic transference. It's a compassionate.
I like that. It's great. Thank you.
Thank you.
Thank you.